All right, let's dive right in. Today, we're going to build a visual map for understanding pediatric leukemia. We are going to trace the entire disease process, step by step, from that very first faulty cell all the way to the critical nursing priorities you absolutely have to know for your exams. So let's kick things off with a classic clinical scenario. A child comes in, and the story is always the same. They're tired all the time, they keep getting sick, and they're covered in bruises. So, what is going on here? What's the story their blood is trying to tell us? Well, it's a story of chaos. And by the end of this, you're going to know exactly how to read it. All right, here's our game plan. First, we'll tackle what I call the factory takeover, the root of the problem. Then we'll see how that causes something called the crowding out effect. From there, we'll break down the 3 critical consequences for the body, learn how to read the signs, and finish strong with the absolute top nursing priorities. Okay, first things first. We got to get to the very heart of the problem. And to do that, we have to think of leukemia as a hostile takeover of the body's most important factory. So the official by-the-book definition is a malignant increase in the number of leukocytes, usually at an immature stage in the bone marrow. And I really want you to lock in on those 2 words, malignant and immature. Because this isn't just, a high white blood cell count. This is a cancerous, out-of-control flood of cells that are completely useless. Now, to really get this, I want you to picture something in your mind. Imagine your bone marrow is this incredibly busy, high-tech factory. Day in, day out, its one job is to pump out all the critical parts for your blood. Your red blood cells for oxygen, your white blood cells for fighting germs, and your platelets for clotting. So, what happens in leukemia? Well, it's a hostile takeover. This factory gets completely hijacked. Instead of making healthy, functional cells, the production line gets overrun by these faulty workers, these immature blast cells. They're just taking up space, clogging up the assembly line, and they can't do any of the jobs they're supposed to. But how does it get so bad so fast? How does this takeover completely spiral out of control? Well, that brings us to our next key concept, the crowding out effect. Okay, this right here is the initial domino effect. It all starts with a tiny bit of genetic damage in just one single cell. But that one faulty cell starts multiplying like crazy, creating this massive army of useless blast cells. And here's the key. They're literally crowding out all the good, healthy cells that are trying to do their jobs. And that's what leads to a total shutdown of the bone marrow. So, you've got this shutdown happening inside the bone marrow. But it doesn't just stay there, right? The impact ripples through the whole body, leading to 3 critical consequences. And listen, if you're studying for an exam, this next part, this is the absolute core concept you have got to master. And here it is. This is the whole story on one slide. Think of this as your whiteboard moment. Let's go row by row. First, the factory stops making red blood cells. The result? Anemia. And what does that look like on the outside? Fatigue and pallor. Next, production of mature white blood cells stops. The result? Neutropenia. What's the effect? A massive, sky-high risk of infection. And finally, the platelet assembly line shuts down. The result? Thrombocytopenia. And the effect? Bleeding and bruising. See? It's a direct chain of cause and effect. Okay, so we get the chaos that's happening on the inside. But what does a nurse actually see? How does all this show up on the outside during an assessment? Let's make that connection. So first up, anemia. Think about it. If you don't have enough red blood cells to carry oxygen, what happens? Of course you're going to be pale. Of course you're going to be exhausted. You might even lose your appetite. And the labs will confirm it all with low hemoglobin and hematocrit. All right, next, neutropenia. This one is huge. With no mature white blood cells, the body's entire defense system, it's just gone. It's left wide open, and that's why a fever, which is usually a good sign of the body fighting back, suddenly becomes a 5-alarm fire. It's a medical emergency. You'll also see things like swollen lymph nodes or an enlarged liver and spleen as the body desperately tries to compensate. And our third big consequence, thrombocytopenia. The signs are all about bleeding. You might see these tiny little red dots under the skin. That's petechiae. That's a classic sign. Or it could be a massive, life-threatening hemorrhage. And the bone pain? That happens because the marrow is just so crammed full of those useless blast cells that it actually starts to hurt. Okay, we've done it. We've connected the dots from a single faulty cell all the way to the symptoms. But now for the most important question. What do we do about it? Let's lock in on the two biggest, most critical safety priorities: preventing infection and preventing bleeding. Everything we do from here on out boils down to two big ideas: cellular regulation and safety. It's all about trying to manage the internal chaos and, most importantly, keeping that child safe from the fallout. This right here, this is pure gold for your exams. These are the must-know infection precautions. So why a private room? Why are we so obsessed with hand washing and masks? It's about creating a protective bubble around this child. And no fresh flowers or raw veggies, because the bacteria that's totally harmless to you and me on a piece of lettuce could be deadly for them. We avoid invasive procedures, because every break in the skin is a wide open door for infection. And now, for the flip side of that safety coin, bleeding precautions. The name of the game here is gentle. Everything is about preventing any kind of trauma, no matter how small. We use a soft toothbrush to stop gums from bleeding. We avoid aspirin and NSAIDs because they mess with the few working platelets the child has left. We need every last one of them to be working perfectly. Our job is to protect a body that has lost the ability to protect itself. So there you have it. We've walked the entire path, from that one broken cell to the complete factory takeover and the critical safety nets we need to put in place. I'll leave you with this question to really let it sink in. Knowing all this, knowing about this factory takeover, how does it change a nurse's approach to something as simple as taking a temperature or giving a medication? The answer, as you now know, is that it changes absolutely everything.